Good afternoon. I'm Ann McEnerny-Ogle, Mayor for the City of Vancouver, and today is Wednesday, May 20th. Thank you to Alex and Abel, our American Sign Language interpreters today. Yesterday, Governor Inslee announced that Clark County, along with 9 other counties in Washington, can apply for Phase 2 sooner than expected. The Washington State Department of Health has outlined several requirements we need to meet before granting that approval. Our public health agency is still reviewing those and believes that Clark County can meet the necessary criteria. Clark County Public Health is in the process of preparing the application, but it'll still require approval of the Clark County Board of Health before it's submitted to the state for review. And we don't know yet how long that process and review will take. Until the application to begin Phase 2 is approved, Clark County is still in Phase 1, and residents and businesses should continue to follow the Phase 1 guidance outlined by the governor until a determination is made upon our request. This morning, the Clark County Board of Health met to hear from Dr. Melnick, but they have not yet voted. After Public Health puts together the necessary information for the application, then the Board of Health and the County Council will hold 2 separate meetings to approve the plan. We don't have a timeline yet on how soon that'll happen. When Clark County is approved to move to Phase 2, we can expect to see the following businesses and activities resume. You can gather up to 5 people from outside your household for the week and have an event. In-store retail shopping can happen. Dine-in service at restaurants and taverns, but remember we have that limited at 50%. Hair and nail salons and barbers can start. In-home services such as nannies and house cleaning. Real estate transactions can happen. Outdoor recreation, again involving 5 or fewer individuals outside your household, such as camping in the beaches. Professional services and office-based businesses, so working from home is still strongly encouraged. And essential travel and non-essential travel is limited in both Phase 1 and Phase 2, but there's permissible activities. It's important to note that people who are considered at high risk for COVID-19 are being asked to continue to stay home until we reach Phase 4. When we do enter Phase 2, individuals are asked to continue to engage in physical distancing and encouraged to wear face cloth coverings in public spaces. Businesses that reopen in Phase 2 are required to implement health and safety measures to protect their employees and customers. And this includes, again, maintaining that 6-foot physical distancing requirement, providing adequate sanitation and personal hygiene for employees and customers, and ensure frequent cleaning and disinfection of the business, particularly those high-touch surfaces. Again, we're looking forward to the news regarding the status of Clark County's application to enter Phase 2. Part of that will be the case interviews and contact notifications as important tools for slowing the spread of the virus in our community. But there have been a lot of misinformation out there on this topic, and I wanted to provide some information from our health department. So what the process for contact notification looks like in Clark County can be found on their website. But they've provided a little bit of information. And right now, every time someone tests positive for COVID-19, healthcare providers will notify the Clark County Public Health. After receiving the report, Public Health will call the sick person to see how they're doing. They're asked to stay home until they are no longer considered contagious to ensure that they don't spread the virus to others. Clark County Public Health will also ask the sick person to share some information. The questions they will ask include, did they have symptoms and when their symptoms started, where they went while they may have been contagious, and who they had close contact with while they may have been contagious. This information is kept private, and public health will only use it to identify close contacts who may be at risk of getting the virus. So who's considered a close contact? Well, a close contact would be anyone who cared for the sick individual, who was within 6 feet of the sick person for more than 10 minutes, was near the sick person's coughs or sneezes, or may live in the same home as the sick person. Public health will call each of those close contacts and ask them to stay home for 14 days so that if they develop the virus, they don't get others sick. Public health will also call or text close contacts every day to see if they're developing symptoms, and if so, will help them get treated. They will also ask if they need other help, such as being tested, and if they would like someone to pick up their groceries. This process for contact interviews and notifications isn't new in Clark County. The same process was followed during the measles outbreak last year. So as Clark County moves through the opening phases and more people are out, this type of contact notification process will continue to be important, as acting quickly is crucial to slowing the spread of COVID-19 and to keeping our community safe, healthy, and open. Thank you so much. Please take good care of yourself and help us prevent the spread of the virus.